Welcome to Training the Next Generation. In light of the recent changes in regards to the Australian minimum education levels for naturopathy and Western herbal medicine, the NHAA Board of Directors has asked me to provide open access to this presentation, which is based on a presentation I delivered at the 8th International Conference on Herbal Medicine in April 2013. This is in the hope that it will help people understand the rationale behind some of these changes. Firstly, a little background on myself so you understand where I'm coming from. My name is Breakspear and I've been a herbalist and naturopath for 21 years and an educator in these disciplines for 18 years. I've taught at diploma, advanced diploma, bachelor degree, graduate diploma and master's degree levels. I've designed courses ranging from advanced diploma to graduate diploma level. I'm a member of the subject matter expert group advising the Industry Skills Council on the Australian Health Training Package. And I'm a former Vice President and current Fellow of the NHAA and a current teacher and clinician. I'd like to open with a quote from a French psychologist who specialised in education, which will provide some context for this discussion. The principal goal of education is to create men and women who are capable of doing new things, not simply repeating what other generations have done. Men and women who are creative, inventive and discoverers, who can be critical and verify and not accept everything they are offered. A key question here is, do we achieve this outcome with the current standards in naturopathy and Western herbal medicine training? To answer this question, we need to set the scene. In naturopathy and Western herbal medicine, the minimum clinical entry qualification is the advanced diploma as specified in the Australian Health Training Package and adopted by the professional associations. Bachelor degrees are available, but they are not yet the entry standard. So what exactly is an advanced diploma? Well, it starts with the document known as the Australian Qualifications Framework. This is the national policy for regulated qualifications in Australian education and training. It incorporates the qualifications from each education and training sector into a single comprehensive national qualifications framework. It's important to note here that it is not specifying education standards in specific disciplines, but rather levels of education for all kinds of disciplines. It does this by classifying 10 different levels of education, and each level defines the relative depth and complexity and the expected autonomy of the graduate. This is the AQF wheel, which clearly shows the relationship between the different levels and qualification types. In the 12 o'clock position, we have level 1, which corresponds to certificate 1. And at the bottom, we have level 6 advanced diploma and level 7 bachelor degree. Now, looking at the key differences, pulling out the key information from the AQF on these different qualification levels, we see for advanced diploma that graduates are expected to be paraprofessionals, to work with some direction when initiative, judgment, planning or management functions are required, and the volume of work expected within an advanced diploma is the equivalent of 1.5 to 2 years full-time. For a bachelor degree, graduates are regarded as professionals. They are expected to exhibit critical thinking, to solve problems with intellectual independence, and to work in collaboration with others, but not under the direction of others. And the volume of work is generally expected to be 3 to 4 years full-time equivalent. So a big question here is, are we as naturopaths and herbalists paraprofessionals or are we professionals? If we look at the Oxford Dictionary of English definition of a paraprofessional, it's a person to whom a particular aspect of a professional task is delegated, but who is not licensed to practice as a fully qualified professional. Is this what we are, and is this what we want to be as naturopaths and herbalists? I would argue that we are definitely not paraprofessionals. Most of us work in independent practices, working autonomously as healthcare professionals, making decisions around the assessment of patients, the treatment plans, and indeed administering ingestive medicines. And that certainly doesn't fit into the domain of a paraprofessional. Now, for a number of years, we have had Bachelor of Health Science upgrades for graduates of the Advanced Diploma qualifications. These have existed since the 1990s under arrangements between private colleges and universities. And indeed, they're required pathways, articulation pathways, for any provider offering the Advanced Diploma. So what are these upgrades? They often consist of generic health science units from nursing or from public health degrees. In general, they do not contribute, unfortunately, to the intellectual and professional independence or the deeper clinical and critical analytical skills required of a naturopath or a herbalist. Whilst they do increase the scientific understanding of healthcare in general, they do not focus, many with their own admission, on the specific modalities of naturopathy and herbal medicine, and they certainly do not focus on increasing clinical and critical reasoning skills in naturopaths or herbalists. And these pathways are also decreasing in availability. Some universities have discontinued them, and many prospective students have remarked on the lack of focus in naturopathic or herbal medicine within these qualifications. So in short, Bachelor of Health Science upgrades do not turn us into level 7 standard clinicians in naturopathy or in herbal medicine. So looking now at other advanced diplomas available in the health training package, in complementary and alternative medicine, we have the advanced diplomas of aromatic medicine, Ayurveda, homeopathy, naturopathy, nutritional medicine, and Western herbal medicine. In the non-complementary and alternative medicine line, we have the advanced diploma of dental prosthetics, and these graduates don't make clinical decisions. They work in conjunction with a dentist. There's advanced diploma of Aboriginal and or Torres Strait Islander primary healthcare, brackets community care or practice. And again, the graduates here work as adjuncts or assistants in healthcare or in health service management, not as autonomous health professionals. There's an advanced diploma of neurophysiology technology, and graduates here provide assistance to neurologists. There's an advanced diploma of nursing, brackets enrolled Division 2 nursing, and graduates here provide nursing care under direction and supervision of a registered nurse. And finally, there's the advanced diploma of paramedical science, brackets ambulance. This is in a bit of a confusing situation with bachelor degrees also available, and there is a push within the profession for registration, which is likely to lead to degree as the minimum standard. And it's probably the closest parallel to the current state of affairs for complementary and alternative medicine disciplines. So in summary, with the exception of paramedics, no other advanced diploma qualifies a graduate to practice independently, prescribe and administer ingestive medicines, or make diagnostic assessments. Only complementary and alternative medicine is situated at this level 6 standard. If we look at the educational paths of other health disciplines, in osteopathy, a double bachelor or a bachelor and master's is required. For chiropractic, a bachelor and a master's. For podiatry, bachelor or master's. For TCM, traditional Chinese medicine, a bachelor degree. And these health disciplines are very similar to naturopathy and Western herbal medicine in that these practitioners work independently and autonomously, making clinical decisions about diagnosis and about treatment, and in some cases administering ingestive medicines. So a really important question here is, how can we be seen as health professionals? when our entry qualification is still at a level 6, and whilst other similar health professions are all at level 7 or higher. Looking at recent events, and this slide was added in July 2014 based on current events, the Community Services and Health Industry Skills Council has declared, after considerable consultation with subject matter expert groups, the industry reference group and interested stakeholders, that from December 2015, the advanced diplomas of Naturopathy, Nutritional Medicine, Western Herbal Medicine and Homeopathy will be deleted from the health training package. So this will mean that from December 2015 onwards, students wishing to study in those qualifications, wanting to enter into study in those qualifications, will no longer be able to enter into an advanced diploma. They will no longer be available. Other options will be needed to be available by this stage. So options for changing the status quo. Our first option is to increase the minimum entry qualification to bachelor degrees in the specific clinical discipline. We don't need to wait for registration for this to occur, and it doesn't have to be at a university. Indeed, there are private colleges currently accredited to offer bachelor degrees and offering those in Western Herbal Medicine and Naturopathy. It will require collaboration between professional associations and training providers and will take a little time, although obviously with the current state of affairs of deletion of those advanced diplomas from the training package in December 2015, bachelor degree will become by default the new standard of education for students wishing to start training. Our second option is to foster a community of inquiry. And this is regarded as a group of individuals who collaboratively engage in purposeful critical discourse and reflection to construct personal meaning and confirm mutual understanding. This involves more student engagement, more problem-based learning, more tutorials, and longer courses to enable the students not to just learn information, but to consolidate it, apply it, integrate it, and critically evaluate that information. Our third option is embodying experience in teaching, not just focusing on knowledge. Indeed, the definition of evidence-based practice is the integration of best research evidence with clinical expertise and the patient's individual circumstances and values. So we need to really encourage and foster a culture of teaching embedded within naturopathy and Western herbal medicine, and entice experienced clinicians back into the classroom and into the teaching clinics. Fourth option is to open our practices to students doing external rotations, to really encourage the students to see real clinical environments away from their training institutions and observe experienced clinicians at work. And our fifth option is the apprenticeship or mentoring system. It's a historical method of teaching which was very dominant in herbal medicine, but replaced with and not always improved by formal training systems. It's a great venue for experiential learning, which is often the strongest and most relevant learning to students, and it's something that the NHAA's mentoring system makes a great start with. So to summarise, undergraduate education is where knowledge is learned, skills developed, and attitudes shaped. And it's arguably the single most important factor in the success of our profession. So let's integrate a culture of teaching with all of us contributing to education, and let's really take the qualification level to where it should be and stop being paraprofessionals. Thanks for your time, and for more information, please visit the NHAA website or my personal website. Thank you.